I'm ready, ma'am.
Okay. All right. So if you've read and understood considering it clinical examination station, please begin.
After washing my hands, I would. Hello, my name is Dr. Ali Hayat. I'm one of the surgical doctor. May I confirm your name and age, please?
Yes, I'm Tom, 56 years old.
Nice to meet you, Mr. Tom. Today I've been asked to examine your leg, foot, and that would include looking at your leg and feet and feeling and performing few movements of your leg. Are you okay with it?
Yes.
Okay, can you please take your gown off
Okay.
and can you please stand up for me?
Okay.
Okay, can you please walk towards that wall?
Okay.
Can you please now walk on your heel?
No, doctor, that
Don't,
hurts. I can't walk on my heels.
okay, can you please walk on your toes? I would
No,
be
doctor, it hurts. I can't.
okay. Can you please stand? Let me take a closer look at your knees and leg.
Okay.
Can you please move to the right side so that I can take a closer look from the side?
You'll move on the side.
Is that so? Okay.
Yes, of course. You're
Okay,
not going to rotate the patient.
now I'll look from the side for any scars, any deformity, or any swelling. Then I would ask for the permission to look from behind.
Very
Would
good.
you mind if I
Yes.
look from behind?
Yes.
Okay, then
It's
I'll
okay.
take a closer look from behind. Then I'll ask the patient to lie down. Can you please lie down on the couch?
Okay.
Now I will start feeling your leg and feet. Do you have any pain anywhere?
Yes.
Where do you have the pain? Do you want me
On
to?
my dressing, on my right shin.
Okay, is it bearable or you need any medication?
No, I just took medication.
Okay, I would not hurt. It won't hurt much. Now I would start feeling with the dorsum of my hand,
Okay.
uh, from the foot to the hip, uh, along the path of the common peroneal nerve. I would also feel the scar, avulsion scar on the fibular neck, and I will check for the tenderness. And after that, I would flex the knee and check for the popliteal artery, any swelling or any deformity or any varicosities at that location. Then I would perform, I would check the power. I would ask, I would put my hand, I would lift the leg by my hand and ask the patient to push it down to check for the hip extension. And then I will ask the patient to lift his leg and I would, and not let me straighten it, not let me push it down to check for the hip flexion. Then I would ask the patient to bend his knee and don't let me straighten it. Then I'll ask the patient to uh, straighten his uh, leg against my hand to check for the knee extension and knee flexion. Then I'll ask the patient to move his foot towards his head against my hand to check for the dorsiflexion. And then I'll ask the patient to push his foot against my hand to check for the plantar flexion. Then I will use the cotton bud and I will touch the arm or the chest of the patient and tell him that this is how it will feel. Ask him to close his eyes and then I'll check the dermatomes, L4, L5, S1, L1, 2, 3, and say yes if he feels it. So for L4, I would touch it above the medial malleolus. For L5, I will touch it above. I will touch the dorsum of the foot. For S1, I'll touch the above the lateral malleolus, and for 1, 2, 3, L1, 2, 3, I'll touch the anterior aspect of the thigh. Same I would do with the neurotip to check for the pain sensation for the spinothalamic tract. Then I will check for the coordination. I'll ask the patient to put right foot on his left knee and roll his right foot along the leg up to the feet and do this movement repetitively, once from the right foot and then from the left. Then I will check coordination is done. Then I will thank the patient and ask him to cover.
Okay, please summarize your examination.
Today, to complete my examination, I would like to do the hip and the knee joint examination. Today, I have examined this patient who presented with the complaint of numbness of anterolateral aspect of the leg, and I have noticed a high steppage gait and also noticed a scar on the neck of the fibula, avulsion scar on the neck of the fibula, and there is obvious tenderness on doing the palpation. Patient has weak dorsiflexion and weak eversion. The reflexes are normal, coordination is normal, and patient also have hyposthesia of both light touch and pain sensation in the anterolateral aspect and the dorsum of the feet. The coordination and the clonus is and the tone of the limb is normal.
All right. So, what are your provisional and differential diagnosis?
My provisional diagnosis is common peroneal nerve injury
Yes.
due to radio frequency ablation for varicose vein,
Okay.
and my differential is L45 herniated lumbar disc
Yes.
and sciatic nerve injury, and
Right.
in the central causes there it could be some stroke, brain tumor, or
Right. Please tell
multiple.
me what investigations would you ask for to confirm your diagnosis?
I will do the electrodiagnostic studies like ECS, EMG, MRI,
Okay.
to
And blood analysis to
and
rule
blood
out
analysis.
any metabolic cause. What treatment can you offer this gentleman?
Uh, to decompress the nerve, and we can do the tendon transfer, or we can do the nerve repair, or we can, if there is disc herniation, we can do the decompression.
Yes, and what about the stepping gait? Is there any
Yes,
walking
we can
sport or
use
anything?
ankle. Yes, we can use ankle orthosis, ankle foot orthosis.
Yes. And you can consider physiotherapy to strengthen the weakened muscle. And then first conservative management, then you can offer surgical management to the patient, like tendon transfer, decompression, or repair, etc. Right. What might, okay, you have told me radio because of radio frequency. Could there be any other cause that can lead to common peroneal nerve injury other than
Yes,
radio
neck
frequency
of fibula.
ablation?
Yes, yes, neck of fibula fracture
Right.
or plaster application
For prolonged period of time, right?
for prolonged period of time.
Yes,
Yes,
and the fracture dislocation of the knee.
yes,
Right. And in order to complete, you should also be performing spine examination, spine, hip, and knee.
yes. I
Okay.
said earlier that I to complete my examination, I would like to do.
You mentioned spine, hip and knee. I don't think you mentioned spine.
Yes, I forgot spine. Yes,
Yes. Okay, good. Thank you.
thank you, ma'am.
Yes. Right.